water, so you don't have to put on gloves. So our dry skin number 2 we're gonna perform is called range of motion. When you're doing range of motion, when patients are staying in bed for a long time, we need to move their muscles, we need to move their body so that we avoid them from building what we call contractures in the body. Think about yourself. If you don't use your muscles, you don't use your joints, you wanna lose them. This is what happens. You will lose the function of it. So doing for them range of motion effectively, we just have to encourage the use of those muscles. So these skills have only one critical step. And you need to know the critical step is very important to do them right. Because if you miss a critical step, no matter what you did, no matter you have 90%, but the critical step was not done, it's considered as a fail. And remember, one fail in one skill is a total fail in all skills. So let's do range of motion on the shoulder and the arm. They will give you 2 skills. That is shoulder and the arm, and the knee and the ankle. So I'm gonna demonstrate both of them at the same time, but I want you to have it from back of your mind. At the testing center, they will only give you one. Either range of motion on the shoulder and the arm, or the knee and the ankle. So I want to start with shoulder and the arm. So what do you have to do this? Critical step, you must ask the patient, are you in pain? You have to ask that when you're doing it. Asking them, are you in pain? Because maybe you are doing abduction and adduction too far and they're feeling pain. So once you ask them and they say no, they don't have pain, then you know you're good to proceed on with your exercise. But if they say they are in pain, you need to reduce it. Maybe you are moving them too far. You need to reduce and ask them again, are you in pain? And if you find they still complaining they are in pain, then you need to stop and go and notify your nurse. So let's start with our pre-entrance steps, of which we know we are not going to our own home. We are going to raise their home, and that's their home. We start by knocking and introduce ourselves. Start. Knock, knock, knock. Come in. Good morning. My name is Rain. I'm your CNA today, and I'm going to help you with range of motion. Is that okay? What's your preferred name? The patient will tell you what is the preferred name or what they like to be called. So what I'm doing, you see, I'm trying to multitask. I'm talking to my patient. I'm maintaining the eye contact with my patient. I'm trying to sanitize my hand. At the same, I'm explaining what I'm going to do. So what I'm going to next, I'm going to make sure safety steps. Lock my bed. Raise up the bed to my working level because I don't want to break my back. Look how tall I am. And I find myself bending. How long do you think I can work in this field? This job is physically demanding to your body. You have to know how you take care of your body physically. So once I raise my bed, I'm going to go ahead and I'm going to provide my privacy to my patient. And next, what I'm going to do, I'm going to start my mental. This is the side way. I can move them down because I want you guys to be able to see from those who are on that side. So I'm going to move it sideways. Then I'm going to only expose the side that I need. Look at this. I like to tell students, try to put your pen and go like this. So whenever I go like this, look at where I want my palm is supporting. On the palm, another one under the elbow. So once I know I have it like this, I know I'm going to go all the way to back. I tell students, have 3 by 3 in your head. When I say 3 by 3, we're going to do 3 sets of exercise in a count of 3 times. So let's start. Number 1. 1. Jimmy, any pain? They say no pain. 2. Any pain? No pain there. 3. Any pain? No pain. So once I have that, I'm going to go outside. 1. Any pain? No pain. Come back. 2. And pain, no pain, come back. 3, and pain, no pain. So I'm going to do our arm. Let's go. 1, and pain, no pain there. 2, and pain, no pain. 3, and pain, no pain. So you can imagine by that, you should have got it done with your scale by just doing the shoulder and the arm. Because I'm now extending to show you at the same time how can we do the knee and the shoulder. So what I'm gonna go ahead and do, now look at how we're gonna go. We're gonna go the same trick. One of my palm has to be between here and the support here. Then I'm gonna go all the way up. One, all the way back. Jamie and pain, no pain. Two and pain, no pain there. Three and pain, no pain. Sometimes some patients they're non-verbal. You need to look on their face of expression. How do you see? Are they in pain? You can tell by their look. So next, I'm gonna do the ankle. I'm gonna switch one and out. Two and pain, no pain. Three and pain, no pain. Next we're gonna have to, so this is what I tell them. I'm gonna put my palm here, Jimmy. You're gonna push my palm. So whenever they push, we go front. One, come back. Two, we come back. Three, we come and pain there. No pain. And once I'm done with all those, make sure we're gonna have to end by covering our patients. Cover it up. Raise up the side leg. I'm gonna raise the side leg up. I'm gonna give Jamie, this is your collage, in case you need anything, and then make sure you give them physically and they hold it. So, I always say our exit steps, never leave the bed in a higher position. So I'm gonna make sure I'm lowering my bed. So once the bed is lower, and make sure you are lowering until the bed can no longer move down. Because I see students go to the testing center, they lower, but they don't completely make sure the bed is completely down. Then I want to remove my privacy curtain. I'm going to remove it. And remember what we started with? We started with sanitizing our hands, and we have to make sure we finish by sanitizing our hands. Then if you think there's something you must have forgotten or you did not do, you have the chance to correct yourself, to get the credit back. Tell the examiner, tell the instructor who's watching you, please instructor, I forgot to give Jamie privacy. You can get that credit back, but you cannot undo a critical step. If you forgot to ask, are you in pain, and you say, I forgot to ask, that one they will consider was not done. So if you still find you have done that mistake, missing a critical step, you have to immediately redo the whole skill. So that puts at the end of our skill for range of motion for both shoulder, the arm, and the knee and the ankle. Thank you.